We are the one, the light in the dark. One heart, one world, one spark. We are the one, together we rise. One dream, one voice, one sky.
Hello, welcome to Women Empowered Across the World. I am Jackie Zaccoli, and I am, so to speak, pinch hitting for Carol Witt today and bringing you a really exciting guest that we are finding doing all kinds of wonderful things, of course. That's what our guests are. And I would like to remind you that we are on YouTube and are really building that strong database and that presence. And we'd love, love, love for you to come join us in whatever capacity that you can, whether it's to be interviewed so that we all can find out what you're doing, or to be part of another continent if you are in that as well. At any rate, let's share what we are doing. And we have as our guest today is Dr. Noella, and she will be telling us a little bit more about her business and her nonprofit in Cameroon. So, Dr. Noella, please share.
Thank you very much again, Jackie. Thank you, everyone. Alina, thank you. I really appreciate you all for bringing me into this platform. I'm really honored. Thank you. And I'm Dr. Gwanyama Noella. I'm a medical doctor, and I've been practicing for 6 years now. And presently in Cameroon. And I'm the founder of Talk Pregnancy with Dr. Noella. Many people call me Dr. Pregnancy. So what happened was once I finished my medical school, what actually brought my passion in was when I finished medical school and I went to start working in the hospital where we did most of our training. That's the main referral hospital in the region. And that's the region which is highly affected by the crisis now in Cameroon, the English speaking part. So once I started there, I worked at the maternity unit and I experienced a lot of women frustrated when maybe their baby died and the family too when they lost the wife. For example, the man losing his wife and maybe a whole support system of that family. I just knew in my mind that I had to do something, but I did not really get into it until I was faced with my own complication. When I had my first pregnancy, everything was going on well. Sometimes even the nausea, vomiting, I didn't even have them. Sometimes I even forget that I was pregnant until I have to even touch my bum before I know that I'm pregnant. I carried out over 200 cesarean sections so far. I've done over 200 cesarean sections. And seeing the challenges that these women were going through, you see a woman who came today and will say, okay, go and come back tomorrow. Let's check and make sure that everything is fine. By the time she's coming the next day, you want to check the heartbeat of the baby. It's not there. What's happening? What happened? The baby died. And there was one case that really struck me. She had 4 children. She was looking for a boy. You know, our African tradition, they always need a boy child to succeed over the man. And this last baby was a boy. Full term pregnancy, 9 months, full term. So she came and we had to give her a follow up visit after 1 week to maybe for her to get into labor normally. So when she came the next day, we had to check. She didn't even know that the baby was not alive. We had to check and we discovered the baby was dead. So when we asked her, what did you discover any change in the movement? She said she had no idea. She was just coming for a normal checkup. So that one that was in my mind, even for my first pregnancy, it just got me thinking. At 9 months, I saw myself so strong. I said, okay, this is a time when labor can start at any moment. Let me just go and check to make sure that my baby too is fine before anything. And that was the beginning of the week. And you know how beginning of the weeks are always the place is jam-packed, full with patients. I was so very calm. I went to the radiologist to check. He told me he was to come at 8 o'clock and he finally came at 9. But I don't know the patience I had. I said, no, myself first, of course, before I could be able to take care of others. And behold, when he was checking, he saw that there was a cut round the neck of the baby, and already a knot formed. And he had to check the perfusion of the brain to see whether it's already compromising, and it was already midway. So it means that the baby was at the verge of suffocation. I asked him that, what is the meaning of that? He said, just go and see your obstetrician. As I went, he just had to call the other gynecologist, and immediately it was a cesarean section. Once they did that, luckily the baby was fine. And after that, I suffered some other complications. And I told myself, because I owe no one to actually go out and start talking about it. Even I did not say it, it wouldn't have changed me. But I saw it upon myself, like, how about those other people? These are how people are getting complications, and we can identify these complications very early and manage it, because most of our causes of maternal, because I'm part of the maternal and neonatal death auditing in the region, so most of the causes were due to late arrival in the hospital and late identifications of complications. That was the main thing. That was how I set out to educate women on some certain aspects, what they should know, what they should do. And I just went on Facebook. I said, rather than me just putting on, today is Sunday, I'm back from church with my family, and this and that's all. No, let me just start up something and just start educating people about it. So when I made the first post, I spoke about cesarean section, especially the fact that people who were meeting me and saying, "Oh, doctor, so they operated you too. Does it mean that you are weak? Does it mean that you were not able to push?" So I also saw that thing as a misconception, even around my immediate cycle. I knew that there was more to be done. I just had, that was when that desire pushed me out, that it also happened to me. So other people, it is happening to them. How can I help them? I started the first post and said, okay, with the cesarean section, that's not all. You can still have a normal delivery after that. You can still have the number of children you have. Oh, people started taking interest. People came and started asking, what about this? Doctor, what about this? I was like, okay, so it means they have more problems than this. It means what I'm even seeing is a small picture. There is more to that. That was how I developed a whole community, started talking about pregnancy, women related health issues. And I started having people even in the hospital coming to meet me to advise them, what next, doctor? What should I do? I was like, oh, me, I was no. And that was how it showed that what I was doing, that was the positive feedback I got from them. And we started reaching out to a lot of people. I also said, rather than just reaching out to these people on Facebook, there are other people on other social media platforms. I created other platforms, even on YouTube. I do YouTube. Now we are over 41,000 subscribers, and over 2.1 million views on YouTube. And from there, we have had over thousands of women consulting us both online and on site. Now, one thing that actually skipped me out from the online thing to the community, there was one person who came and told me, now, asked a question on the comment, said, Doctor, this thing you're saying online is very important, but there are people who don't even have access to Facebook. They don't know how to do it. Even if they are there, they don't know how to really understand the way you are saying it. But I'm seeing that people in the suburbs have to hear what you are saying. I just told him that if I have to go into the community, you're going to be my first volunteer. He said, no problem. And that was how I got my first volunteer. And I decided to just call some of my colleagues, some of my friends. I just threw out the solution, the problem to them, and they're willing to join me. That was how we did our first ever campaign on site, visiting a village, discussing about pregnancy, the importance of early diagnosis, importance of antenatal consultations, genetic testing, especially with sickle cell disease. That was how we did our first campaign, and now we have carried out over 30 community engagement campaigns where we have reached out to suburbs. There are some pictures you can see me on the bike, we climb on a bike for over 4 hours into climbing hills and grade and coming back 4 hours late in the night. So those are the impacts we have created. Then we have luckily we have had some grants, which because our focus area and our vision is to see that every woman enjoys their pregnancy and not being scared that maybe if I develop this, I'm going to die. No. At least if there is a complication, it should be caught up very early. And with this, we had a grant to improve the uptake of antenatal consultation. And through this, we reached out to 200 pregnant women, screening them for common complications like hypertension, diabetes, malaria, did them free ultrasound scans. And from there, we identified people with a lot of complications and we started them on treatment. And this, after we trained doctors, we trained community health workers. So these community health workers were to go into the community, identify pregnant women, identify those high risks, and refer them immediately to nearby health facilities for continuation of care. And this actually improved the antenatal uptake in that community. And now, presently, we have said that we are out to promote preconception care. Preconception care is an aspect which is not even practiced in our setting. We have gynecologists in our settings. They can count how many people have come for them for preconception care. Anyone who is coming, they must have had a complication before, maybe with their previous pregnancies, or they are trying to get pregnant. But that's practically because they have a problem. But preconception care is for everybody who wants to get pregnant. So we have decided to bring this forward to see that these identifications of complications should be right from the beginning, even before they get pregnant, because these are the things that we can catch. And we even carried out a research, and it showed that 68% of people had knowledge of young people in Cameroon had knowledge on preconception care, but only 33 could even practice one aspect of it. So it shows that we still need to implement. It's bulky, but we have to make sure that we bring now a complete structure on how they can easily practice preconception care. So our main plan now is actually to make sure that we come out with complete guidelines that doctors can follow. So we train them. We're going to train the doctors, train community health workers. So these doctors will have the tool necessary for them to just practice the preconception care. Then the community health workers will practice just the primary measures at the level of the community. Then those with abnormal results will then refer them to nearby health facilities. So they check them up and all that. And in that case, once you know that this is what I'm expecting during pregnancy, you already know the danger signs now. You already know that, hey, when should I start antenatal consultation? As early as possible. Once you get pregnant, you start antenatal consultation. So this will increase definitely early attendance of antenatal consultation, and two, early management of any complications that set in, and increase definitely the uptake of antenatal consultations. So we have distributed folic acid as well to over 300 women who are planning.
Wow.
Yes, we had a crowdfunding campaign where we actually got funds, which was even more than the funds that we anticipated. We screened 200 people, both men and women, on diabetes, hepatitis, hypertension, obesity, which are all things which can affect your health before you're getting into pregnancy. And those who were identified with complications were put on management. And if there's one that I'm really following up to now, who was hepatitis positive, then there was a man who was with diabetes. So we have really been following them up through this, then distributed folic acid, because we know the importance of folic acid. You see some women coming to my office to consult their children, then they say, oh, doctor, please, remember, you're saying about folic acid, please give my own folic acid. So they collect their own folic acid. They collect their own folic acid and go. So we have a record where we keep all the people, the women who have benefited from the folic acid. And there was one who was having difficulties to conceive. Most of the pregnancy she was having were blighted ovarian. That's, they are pregnant, but the baby inside is not well formed. Those are malformations that come in with folic acid. So we gave her, she took for 3 months, and now she's pregnant. The heartbeat is present. So she was so happy and she expressed her joy with us. Another one was someone who had the genetic disorder for sickle cell. She had the trait. Then her partner that she brought to, that was actually my classmate. I usually just send it to my group, send it to them. I don't know that they were all watching and all the time. So she entered my office and said, I've come for preconception care. I said, oh, she brought her partner too with her, because we said it is two, not one, please. If you're coming, come with your partner. He is also to put it. So she came with her partner. We did the checkup and she was AS. The partner was AS. So we had to cancel them. And finally, they hit to our advice and they separated. 1 year after, she came now with a new partner who is AA, and they have come now for their preconception care. So those are some good stories and the impact of what we have been doing. So
Wow.
presently, what we are doing now is we have an online community with over 634 people, where we talk about preconception care monthly, anything about preconception care. The last time we were talking about miscarriage. If you have had a miscarriage before, what next? How can you prevent this next miscarriage using preconception care, maximizing your health and optimizing it during the preconception care period before you get pregnant for the next thing. So it was wonderful. We are out to advance it because people have to know about it. People have to start practicing it, and people have to start doing preconception care. Like, why are others benefiting and you two are not benefiting? So this goes a long way to do what, increase to uptake of family planning as well. Because definitely, if someone starts taking folic acid and you fall pregnant, you will not tell me that it's an unplanned pregnancy. No way. It is once you're taking folic acid, therefore you are already thinking that you might get pregnant. Maybe it might not be that time which you are, but of course you were planning already to get pregnant. So it goes a long way to reduce unwanted pregnancies. So, just to go again, maybe on a leadership aspect, so through the work we have been doing, I applied to for the Mandela Washington Fellowship, which is a very prestigious program funded by the US government, and we're selected out of 5,000 applicants. They had to select 17 from Cameroon, and I was among the 17 who were selected. And I studied leadership in civic engagement at the University of Delaware, where we spent almost 2 months there. That was my first time going out of the country. That was my first time going to the United States. And through that, it opened a lot of doors, because when I came back, I had other international opportunities out there. So it has really also, because when you start this kind of thing, it's almost, you need someone to push you. But sometimes you might not have that people around you who believe in what you're doing. You see some of your classmates, some of your colleagues, that they are just seeing it. Yes, I see you going. But when I won the Mandela Washington Fellowship, that was almost like, they always say, don't bother about what people are saying. Just show them the impact. So many of them had to reach out to me and say, so it was that small talk pregnancy with Dr. Noella that got you to the US. So that is how impact, once you're doing the work, you're doing well, and serving the community effortlessly, and just giving back, because the aim was just to give back. It was not really for all this, but definitely other things are going to come in, other things are going to push forward. And just to conclude and round up, I hope that I was
We're
not
at,
too
yeah, it's
deep.
20 minutes. You're ready.
Yeah.
Yeah, finish
So
it.
the last one now, maybe after the Mandela Washington Fellowship, I saw my dreams, at least it showed a validation of what you were doing. And you saw how others appreciated the work you were doing. So in this, with that, I had to see now a way to, because other doctors in our settings, they have just this particular way of, because they see me like I was not really into practice. I said no, I'm practicing, it's just that I'm still using my other skills to help other people. So you as a medical doctor, it does not end just at the confine of the hospital. If you see a patient now, you have to think about how should they prevent this from them so that they don't come back. So it's not just about you seeing the patient, giving medications and go home. No, there is more to that. There's community engagement, preventive medicines. Even you as a medical doctor, you might lead as a head of a hospital. How do you do leadership? You might own a hospital. How do you do about business if you don't know about business? So that was when I came up now. I co-founded also the Cameroon Young Physician Network, where we empower young physicians on leadership, business, community engagement. And we held the first ever conference last year. It was really massive. And from there, you see young doctors who wanted to do certain things go online. They didn't know how to do. From there, they are now excelling on online. They are now engaging in their communities. They are now really impacting their communities in the way they want to do it. And they feel fulfilled. And that's the joy, giving back to others, to my community for health. For my passion is giving back to pregnant women. And as a leader who believes that leadership is good when it's knowledge is good when shared, I therefore turned back as a leader to help other young physicians to go for their dreams, to push forward for their purpose and live a fulfilled life. Thank you.
Beautiful. Oh, thank you so much, Dr. Noella.
Wow.
Your background is so inspiring and all of the steps that you've taken. And I know we have questions for you. It's just really amazing to watch what you've done. Who would like to do the first question? Renata, go ahead.
Oh, thank you, Dr. Noella. It's so beautiful to see that. And I really resonate with you because I don't see anything more important than link education with health. So it's so important and impactful. So my question for you is, what are the biggest challenges to talk about leadership with young doctors?
Mhm. That's a very good one. And if just to answer that, it was the way I took it, because I had this idea since in mind when I started this organization, when I started Talk Pregnancy with Dr. Nuela and saw the effect, how it was going. But I did not implement because I knew that we need sometimes to have that validation. Because once you do that, that's why even when I launched the Cameroon Young Physician Network, reaching out to sponsors, people sponsor the project. They even gave more than the amount. Even after the project, people were even sending. So I believe, and the people who came to for the conference, it was massive. I was surprised. So I think that it's about from that aspect, it's about you also walking the way for them to see. Once they see that you can go through that way and help them too, it means that you too went through those challenges, so you can go back and help them like a mentor. So the main challenge was to start even. That was the main challenge to go in, to put myself out there to help them. That was my main challenge, and I overcame when I had that fellowship, and also the award for the Cameroon, for the young physician, for the Cameroon Youth Award for Health and Wellness. I won it in the whole country for that time. So that really gave that steam.
Cool. So start with
Thank you.
small steps.
Yeah.
Absolutely. Makes sense.
Mhm.
Elena.
Oh yes, thank you, Noella. It's you know what I do. So yes, I am full of emotions and thoughts because, as you probably know, saving lives at birth in Africa is the core of Yorga's Foundation, and it was a reason for me to start Yorga's Foundation. when I realized how many women just die from preventable reasons related to pregnancy and childbirth. So chapeau bas and kudos to you and your team. I really admire your work, and I believe we can join our efforts, join hands, and do something together for Cameroonian women. For sure, me and your Gas Foundation,
sure.
we are ready to work hard with you. So now my question is related to this topic, because in 2020, WHO indicated the maternity mortality rate in Cameroon was around
407.
30 something.
38.
Do you know the latest data, the latest numbers, and what are the main reasons? However, I can expect they are very similar to the reasons in other countries, like what is the percentage of maybe just hemorrhage, postpartum hemorrhage, and infections, because this is what we prevent infections by distribution of mama kits, for example, right? So I would like to know some details from you as a professional.
Yeah. So, answering your first questions, now the recent research is talking about 407, around 407 now, yes. And most of the causes, there was a research that was just published, I think late December, that showed, it actually identified that late arrival at the hospital was the main, yes, was another main cause of this maternal mortality. And the main problem with Cameroon now is the crisis, because in the northwest and southwest now, people who were living in the suburbs have all left from wherever they are. These main cities, like the capital city, the economic city, are jam full because people have left and gone there because that's looking for security. So there are more people internally displaced. People who are living in these regions now are really internally displaced. We who are living in the northwest region here, it's not easy. Sometimes we stay almost like 2 weeks without going out. When they say it's a shutdown, we don't go out, we stay at home. If we have to work in the hospital, they put a group of people that you work for this 1 week. Then in between, they usually open the roads. We pass, then we take the next set. They sleep in the hospital for that time. So it has really, really affected us this way. So the main thing now, people really don't give their priority to health is almost the second option. They try first to survive. They try first to feed themselves. And if someone, you will not see someone really saying, if the person is fine, to go to the hospital. The first thing is, let me see what my family will eat. And then, are we even alive today? So that was the main thing, delayance to reaching the hospital. And by the time you're delaying, then complications are already, because I work at the referral hospital in the region, the main referral hospital. So all the cases that come from the suburbs, they reach us. And there we have to analyze all them. If you see 10 maternal deaths, 8 are referral cases, and most of them come late. Most of them is late. Yes, most of them. So the time for you to do something is not really there. So it's more of preventive measures. If they can do some preventive measures for them to know what is expected during pregnancy, they should even know what's expected. And thank God we just started last year, was it last year, June, that they included now, because there's the universal health coverage, which was taking care only of people on dialysis. Now they've started including pregnant women, but pregnant women in suburbs, not longer, because people who attend antenatal consultations in our hospital, they don't benefit from that. So there are only those in the suburbs who benefit. So most of my women, when I see them, I tell them, please go and register, because with 6,500, that's almost let's say 15 USD, 15 US dollars, yes. With that, you can be able to cover your whole pregnancy, antenatal consultations, ultrasound scans, and doctor's consultation. Then if you deliver and your baby has a complication, it is still inside that package. Yes, so they give that package to them. So once I have my women and once I follow them throughout the preconception care, they are pregnant, I advise them, go and register. Some ones who cannot register now, that's when we help them. We could pay for that one now because that's a complete pregnancy package that we give them. We pay for that, then they help at least it completes that this thing early identification of complication. Thank you.
Beautiful.
Thank you
Yeah.
very much. Thank you.
Wonderful answers. Now we have just a few minutes left. Raksha will be completely direct and clear so that we can get that done.
I don't need to ask her the question. She just answered it in her last
Oh,
Okay.
question.
Okay.
okay.
So it was about insurance and coverage and
Yeah.
if
All
there's a
right.
possibility of that. So
Wonderful.
you just
Yeah.
answered it.
Please
Okay.
put your information in the chat as well so that we can connect with you because you can see in the chat I have resources for you. There's an app in Kenya that's doing exactly what you're talking about already. Would love to be able to connect you. And I also have people in diabetes that are working in the same area. So
Okay.
please put your information. And to wrap all of that up, Carol, did you want to say one more thing?
Yeah, so I really just wanted to thank Dr. Noella for sharing her. Oh my goodness, you are so passionate about this, and it's going to be so enrolling to so many people. I have one question for you, and that is this. I'm all about education, and I get you are. Um, are you doing anything inside of the young people? Because I know there's so many young pregnancies going on. Is there any education that you're doing to really educate them around young pregnancy for youth, for young people?
Yeah. Oh, thank you so much. And just from what I was doing in the hospital, they just newly created, and I was one of the people who created the adolescent wellness center. I was among the doctors. So we have the first adolescent wellness center in the region. I was part of the doctors who created it. So we are there, we help them. So monthly, we have trainings with them. We teach them about confidence, their sexual and reproductive health rights. We tell them that this is how you should navigate life. This is how you do. So all those things we tell them. We have sessions for them. And there's also a pediatrician who is there, who is a parenting coach. So we have all those things that we give to the adolescents.
Beautiful,
Beautiful.
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 Thank you, thank you.
Beautiful.
Yeah, I love that.
That's wonderful. Raksha, one comment.
One comment. The classes that you have for the adolescents at the hospital and stuff, does that include the male population?
Yes,
Good point.
it's everybody, and the
Okay.
most even are the males because especially drug abuse is a problem now. So
Yeah.
we even go to schools, we go and talk, we go to churches,
Mhm.
we bring them.
Yeah.
Oh yes, hey, it's everybody. We start from the age of 12. No,
Oh,
we start from the age
Beautiful.
of 10
yes.
to 24 years. So we have
Beautiful.
the adolescents and the young youths. That's how it's
Beautiful.
divided.
Oh,
Mhm.
beautiful.
Thank
Perfect.
you. Thank you,
Wonderful.
Noella.
Okay.
Yes. Woo.
Thank you so much. We
Yeah.
really
Thank you.
appreciate all that you've
Mm.
done and that now will do because we have resources for you. Just be sure to put that in the chat. You have a choice of putting it into everyone or you have a choice to put it into Carol. So put it under everyone, please, so that we can all get that, if you would. And then we'll wrap up. And again, I thank the audience who's watching this to be able to bring in more speakers for
Mhm.
us, as well as to publicize this as much as possible
Yes.
in our YouTube channel. If you would like to understand how you can be part of it, please let Carol Witt know that, yeathrive at gmail.com, so that we can actually get you as part of the process.
Yeah.
Thank you so much for being here. And thank you, Dr. Noella. This has been very enlightening. And let this be the beginning of some wonderful resources for all of us.
And we stand